I've worked with hundreds of patients whose cholesterol looked normal, yet they were still quietly heading toward heart disease. And very often, this one test is where the real story finally shows up. If you're new here, I'm Dr. Fred Bloem, an integrative physician. A big part of my work is helping people who've been told your labs look fine, but they don't feel fine, and deep down, they know something is being missed. Today I want to talk about cholesterol, but not in the usual way. I want to explain the NMR LipoProfile by LabCorp and why it often changes how we assess real cardiovascular risk, even when standard labs look reassuring. This isn't about fear, it's about clarity and prevention. Most routine cholesterol tests measure total cholesterol, LDL, HDL, and triglycerides. Those numbers tell you how much cholesterol is being carried in the blood. What they don't tell you is how many particles are carrying it, how aggressive those particles are, or how likely they are to cause plaque and inflammation. I've seen many patients with perfect LDL and no warning flags who still had significant cardiovascular risk once we look deeper. That disconnect is far more common than people realize. The NMR LipoProfile looks at lipoprotein particles, not just cholesterol content. That distinction matters. Think of it this way: one truck carrying 10 boxes versus 10 trucks each carrying one box. Same amount of cargo, very different traffic risk. One of the most important markers on this test is the LDL particle number, LDL-P. You can have normal LDL cholesterol but a high LDL particle count. More particles mean more contact with the arterial wall, more oxidative stress, and higher plaque risk. When LDL-P is elevated, I pay attention, even if LDL cholesterol itself looks fine. Another key finding is small, dense LDL. These particles penetrate the arterial wall more easily, they oxidize more readily, and they're strongly linked to insulin resistance and inflammation. When I see this pattern, I'm not just thinking about cholesterol, I'm thinking about metabolic health, blood sugar regulation, chronic inflammation, and hormonal balance. This is where cardiology and metabolism overlap. HDL is another area where people get confused. HDL cholesterol alone can be misleading. HDL particle number gives insight into how well cholesterol is actually being cleared. I've seen patients with great HDL numbers whose HDL particles weren't doing their job effectively. Function matters more than appearance. One of the most clinically useful parts of this test is the LPIR score, a marker of insulin resistance. This score often becomes abnormal years before diabetes shows up, before fasting glucose rises, and before A1C looks concerning. In real life, this helps explain why weight loss feels impossible, why inflammation won't settle, and why cardiovascular risk stays elevated. It gives us a head start, not a late diagnosis. Traditional cholesterol management often turns into one number, one medication, and one standard approach. That misses nuance. When I use advanced lipid testing, I ask different questions. What's driving the particle dysfunction? Is this metabolic, inflammatory, hormonal, or lifestyle related? Treatment may involve nutrition timing, improving insulin sensitivity, sleep and circadian rhythm support, hormone optimization, targeted supplements, and sometimes medication, but deliberately, not automatically. The goal is correction, not suppression. In my experience, this test is especially useful if you have a family history of heart disease, carry weight around the abdomen, are perimenopausal or postmenopausal, have metabolic syndrome, or want prevention rather than surprises. This isn't about being extreme. It's about being precise. I never interpret this test in isolation. I integrate it with inflammation markers, hormones, thyroid function, glucose and insulin patterns, symptoms, and sometimes imaging. That's how lab data becomes insight, not anxiety. Cholesterol itself isn't the villain. The real issues are particle burden, inflammation, and metabolic dysfunction. The NMR LipoProfile doesn't replace clinical judgment. It sharpens it. And for the right patient, it can change the entire trajectory. Now I'd love to hear from you. Have you ever been told your cholesterol was normal, but something didn't sit right? Has anyone ever explained particle number or insulin resistance to you? Do you think prevention should start earlier than it currently does? And would you want deeper testing, or does it feel overwhelming? Drop your thoughts in the comments. I read everyone. And if this was helpful, like, subscribe, and share it with someone who keeps hearing your labs look fine, but knows there's more going on.